Hi, everyone. I'm Elise Morrow Mason, a volunteer event director with Swim Across America, Chicago. I would like to welcome you to our virtual chat, where we're going to discuss how the Pi Kappa Alpha Alumni Association can get involved with Swim Across America. You have the chance to make a huge impact, not only in Chicago, but nationwide. So we really hope you enjoy this program and join us. Here in Chicago, we raise money that goes directly to Rush University Cancer Center, which funds essential research and clinical trials. You will hear from your chairman, Rush, and Swim Across America's CEO. I'm now going to give the floor to the chairman of your alumni association, Michael Holdley.
In my undergraduate fraternity, and then my first job out of college was actually working for Pi Kappa Alpha. And since 94, I guess, when I came back to Chicago, I've been the chairman of the Alumni Association for the Chicago region. I grew up in a swimming pool. I grew up in a YMCA. I was raised by a single mom, God bless her, who Patty got to talk to a lot. But the first chance I got at age 15, I took the lifeguarding course because my grandmother had gotten me swimming lessons when I was 11 or 12. And in the summers, you could not get me out of a pool from dawn to dusk. I never, swam competitively, but lifeguarded, taught first aid and CPR and lifeguarding. And that was my summer job from 16 to 24, which some days I miss, frankly. Because of the cancer surgery that I had, I really can't do any impact sports at all involving my legs. So there's very few things I can do for physical fitness, and swimming is one of them. And and talking to you, Rob, about 2 weeks ago inspired me to get back in the water. So I had my sixth swim, very light practice, very 20 minutes or so, but still, there's nothing like Lake Michigan at sunrise. The water is perfect. If it's calm, it's really fantastic. If it's rough, it teaches you, you're part of nature and you're not the biggest part of nature. But getting out of that it's just a mood elevator. The physical fitness stays with you all day long. I'm so happy to reconnect with swimming, and anybody that does it will get tons of benefits out of it. Even if you're not doing it very much and very hard or very fast, just do it for yourself.
Mike, you have a more meaningful and purposeful story that I think you can share with the people that are here tonight.
I thank you. That's generous, gracious. I wouldn't say that. Of the variety of cancers you can have, I think I got, if you can say so, fairly lucky. Just by way of background, I found Rob because our fraternity, Shield and Diamond monthly magazine, did a story on him, Pike Player of the Year, Pike Player of the Month, and I reached out because I thought the Chicago Alumni Association, I know, has swimmers, I know have people who have dealt with cancer. Another fellow from my chapter, Matt Logan, is currently doing fundraising for Immerman Angels. Because he can't do a marathon this year. So, my own experience was a little bit strange. I was 32. I had broken my foot. I was being treated by John Heffernan at Northwestern. After, my foot healed, I had what I thought was a really bad shin splint because I'd been playing a lot of basketball before that. And asked him, what he thought. He said he didn't know. Let's take a picture of it, which he did. And when it came back, 15 minutes later in his office, he said, I don't know, it could be an aneurysmal bone cyst. The response to which was, for me, what the hell is that? And he said, let's send you to the orthopedic oncologist. And I said, well, I know what that is. And it wasn't reassuring. So he sent me over to Bob Satcher at Northwestern, who was trained at Shands University Medical Center down at University of Florida, and then later went on to become part of the NASA flight program. And Satcher did a bone scan, indicated that he thought one treatment plan might be something called an Elizarov procedure, and For those that don't know, adamantinoma is a very rare bone tumor, occurs in less than 1% of the population. It's a slow growing osteosarcoma-like cancer, and the only way to treat it is to cut it out. So it doesn't respond to radiation or chemotherapy, apparently. And the Elizarov procedure, when I Googled that after leaving his office, just scared the living hell out of me and practically made me weep. And it involves, multiple breaks of a bone over years and resections and external fixators and pin sites penetrating your leg, and did not look like the sort of thing that was going to fit well into a 32-year-old single guy's lifestyle. So I decided I needed a second opinion. And I guess luckily for me, I have really bad fifth left and right metatarsals because I had broken my foot in 2 or 3 other times, and was treated by a gentleman named Dr. Gitellis in Elgin. So I called him and asked him what he thought, and he said he thought I should go see his brother, who's also an orthopedic surgeon in Chicago. So I found Steve Gitellis at Rush, which is where I met Patty, and his partner at the time at Midwest Orthopedics, Walt Verkus. And they were very helpful, but I went and got 2 other opinions actively. A fellow at University of Chicago, whose name I don't quite recall. He had a different pattern of treatment that he had suggested. And then I communicated via email with some folks in Italy, but the only confirming treatment path that I had was after I visited Shands, which is where Walt Verkus also went to school, and was told by the fellow who ran the program down there, and apparently they're very well known and regarded because of their treatment of all the University of Florida football team and other athletes. So they've seen this sort of thing. And I forget his name, but I asked him what he thought, and he said, if he had the opportunity to be treated by either Dr. Satcher or Dr. Verkus, he's very complimentary of Walt Verkus. He said he was one of the most gifted surgeons he'd ever met, and he'd be comfortable in his hands any day. So the most disturbing thing for me is, talking to 4 people and getting 4 different treatment plans and not really knowing what to do. So it's funny, we're in this time of COVID, the fear that the word cancer generates in people's minds, it is very difficult to deal with, aside from the fact that you have to figure out a treatment plan for yourself. And I didn't deal so well with that at first. I think Patty will be the first to tell you that I might have exhibited signs of being perhaps a difficult patient at first. But when I got back and decided to go with Rush and Dr. Gitellis and Dr. Verkus, it was one of the best decisions I had ever made. They had prescribed a limb salvage surgery plan of action, which involved harvesting my right fibula to replace a 13-centimeter segment of left tibial resection and an intermedullary nail that ran from my knee to my ankle, and a bunch of plating and screws, which to this day are still in my leg. It was an enlightening experience. And one thing I think it taught me, and I don't know how you'll edit this, but the conversation from the beginning about COVID, and Rob, your experiences with COVID, I think that all of us in this country are dealing, or possibly the world, are dealing with fear. And the one thing that going through this cancer experience taught me is that knowledge kills fear. And the best thing for everybody is to educate themselves as much as they can about their own health and what they're experiencing, no matter what the problem is, in particular cancer. It's part of the human condition. And we should strive not to be fearful of it, but to take whatever steps necessary to, avoid it or conquer it if and when we have to. So that's kind of my story in a nutshell.
And so our star, of course, is Patty, right? From Rush, we bring in the heavyweights here to then tell us what's going on inside of the medical community. And Patty, you guys have been treating patients like Mike, and you've been part of Swim Across America Chicago since the very beginning. We were talking earlier, 2012, and then now this has just been the most unusual year. How is Rush? how is Rush getting through day to day?
Okay. So Rush has, when they built their new hospital, built it with a vision to be able to take care of a pandemic. And we have. While they were taking care of their pandemic, we were in oncology taking care of cancer patients that couldn't put their cancer on hold. So it's been a very interesting world of taking care of acutely ill patients that had the coronavirus, and then trying to figure out how to safely take care of cancer patients. So fortunately, my hairstylist has kept me looking very young, because this has been tremendously stressful for our whole team, both in terms of trying to reassure patients that it was safe to come to, what in Chicago has become known as the COVID hospital, right, Mike? Have been successfully taking care of patients since the world closed down in March. Some patients we've delayed if they had, benign tumors, but the cancer patients have all come in. We have had no infections with coronavirus on any of our surgical patients. They're all tested before they come in as of May. So it's been a very interesting and a very crazy time for them. The stress level, Mike, you addressed it spot on. Your whole world gets taken down. So then these patients in the past couple of months have their whole world taken down from a cancer standpoint, and the rest of their world taken down because of coronavirus. So the stress level for the cancer patients has now doubled. So I don't know how you go from here to here, but they have. Lots of psychosocial oncology consults with the patients, because they're socially distanced. They can't go and see like you, the young adult patient, can't go and see their families because they are, in another state that's quarantined. It's just been crazy. But Russia's been amazing. They've been thoughtful. They've been super conservative. We still do not let any visitors up on the floors. And it's been okay. Everyone's figuring it out.
And Patty, thanks for sharing with us what's going on with Rush right now during the pandemic. But can you talk a little bit about what Swim Across America means to you and what that partnership looks like at Rush?
So one of our very involved swimmers, Kathy Gray, helped bring Swim Across America, which has been in Chicago, but it was at another hospital, and she brought it to Rush. She had Rush blood because of some orthopedic procedure she's had. So it became a partnership with Rush and Midwest Orthopedics, our orthopedic division, and I got tapped to be the captain of the team because my daughter swam. Now, I emphasized to them that didn't mean I swam. I took swim lessons in college because I was such a bad swimmer, but I accepted the position because it met the needs of the oncology programs to get monies in to do research. And so as Elisa's learning, I may not swim, but I'm all in. And my daughter, who swam from the time, well, she swam recreationally, but she swam competitively since junior high. And for the swimming population, they know that that's a little bit late in the game to start. So I never had to sit through little swim meets where they could barely make it across. It was junior high, which was I think it was a 2-meet season in junior high, and then high school. And she excelled enough that she could and did go to state and ultimately swam at Michigan State as a MSU Spartan. So that's my daughter Morgan's story. Morgan did her swim across America in the version of a half marathon on the 4th of July, which was about 90 degrees in Lake Geneva.
Patty, what success stories have you had during this pandemic with some of the cancer patients?
So some of the unique things that have happened is just trying to juggle patients into surgery with all the potential surges. So Dr. Gatellis had a 16-year-old from the North Shore who had an osteosarcoma, which is a chemotherapy before you cut the cancer out surgery. And everyone from Dr. Gatellis to our administrators to the oncologist over at Lurie's, our children's hospital where he was being treated, were worried about bringing him into, our COVID central hospital. So the hospital administration and Dr. Gatellis and the orthopedic surgeon at Lurie got Dr. Gatellis privileges, which is virtually unheard of for one case, to go over to Lurie's to do this young man's case so he could be in the hospital that had one case of coronavirus. And it was dreamy. I interfaced with all their nurses to make sure they knew what our protocol was. Everyone had each other's numbers. Dr. Gatellis literally walked there the evening after surgery and rounded on this guy. So that really was the evidence that in spite of this coronavirus, we could make cancer treatment safe.
That's fantastic.
Yeah.
How concerned are you that people are not accessing care because of the virus?
Very. So we were so concerned about it that we sent out a mailing, both electronically and paper, to orthopedic surgeons and oncologists throughout the area that we were still open, in spite of what everyone was thinking, that we're just doing coronavirus care, we're not doing oncology. And I would say in orthopedic oncology, I think we're back. After I finish tonight, I've got about another hour or two of work to do. Some of the other areas, patients couldn't even get a mammogram because the mammogram departments were closed down because it was too close. They're open, but now people are afraid to go in. They're even afraid to go to their dentist. So part of our education is letting them know we're open and to reassure patients that we're safe. I mean, I spend my whole life in a mask at the office, so we socially distance. We're very anti-visitors. We do a lot of consultations with a family member on the phone in order to keep everyone safe.
And I'm curious, I know a little bit about some of the research that you guys have done just from the things that I did after adamantinoma, but I'm not familiar with what active research is ongoing and how Swim Across America has facilitated some of it.
The bulk of the research that have been done over recent years has been small, scientific, more basic research on a variety of cancers. Nothing on adamantinoma, Mike, yet. But these are scientists who, because of the seed money that they've gotten, have been able to go on and get NIH grants, which is just phenomenal. So the scientists at the hospital are very involved in Swim Across America and actually come out and swim with us because they get it. They probably get it more than some of the surgeons, because they don't do the basic science. That really is what makes a difference in managing and curing and controlling these cancers.
Surgeons like to cut.
They certainly do.
And Patty, your CEO, Dr. Levy, came out and swam last year too with her daughter.
That was probably the best Swim Across America. So she was new, and the first time I met her, I told her about Swim Across America, and I'm sure Steve Gatellis was like, "Oh, you and your Swim Across America." And she showed up in a beautiful wetsuit that matched her 14-year-old daughter's wetsuit. And one of our friends who has been involved in Swim Across America was one of the Olympic swimmers from the Russia Summer Olympics that didn't get to go and swim. His name's David Sims. Actually swam with her because she is not a lake swimmer, and she was very timid about swimming, and he stayed with her the whole time. There she is. Yes, it was, and that's Dave. His kids all swam with Morgan in high school, so it was so fun. And you know, the MC that day really made a difference because he knew everyone and he knew some of the stories. So that was one of my favorite ones. And plus we didn't get rained out. Another reason to love it. So Rob, do you want to address some of the research overall at Swim Across America?
At its highest level, we make grants in Q4 of each year, and those dollars take us for the next 12 months. And the hospitals, and Rush is one of the best. It's one that we hold up as a model, where they take the dollars that we will have awarded, and then they divide that up into 3 grants this year. But they run a competitive, in-house, fully vetted, scored out like an NIH-style grant. And then they bring those grants forward to our Swim Across America Scientific Committee and say, here are the 3 proposals that we have ran in-house open competition for. We scored, we vetted, that turn out to be the best 3. And we're going to put 2 more on there as well because they're equally good. And we're going to give you a chance, Swim Across America, to help us make a decision on which of the 3 you want to support. That process usually takes about 4 to 6 months to get through, because Rush is doing a large part of the work where they're the ones submitting the RFPs, giving the time for the oncologist to submit them back, vetting them, interviewing them, and so forth. And so we turned that process over to Rush and signed off in springtime, right about the whole time the pandemic was hitting. And we have gone back to all of our beneficiary partners and with a lot of empathy expressed to them, we know this is a tough year. And as we're hearing Patty just share what it's like for the personnel, the staff, and the patients that are participating in these trials, how challenging that can be, that we're allowing them to carry the funds forward or to have flexibility with the funds. So if they need to do their own pivot, maybe it's to a COVID oncology project, for example, or something else that perhaps might be more time sensitive, but of great need within Rush, we're allowing flexibility for our grant to be used to help meet that need within the institution. And then we're also allowing to carry over funds from 2020 into 2021 with knowing and the knowledge on our end that we're not going to raise as much money as we did last year. It's just the numbers are telling us that. And so if an institution like Rush can carry the funds forward, maybe into Q1 of 2021, it will help smooth out some of the grant that we're able to make this later on in December. Thanks everyone for joining us tonight here as we're all coming together to try and raise some awareness and raise some funds for Swim Across America Chicago, which benefits the Rush University Medical Center. And we're appreciative for Mike Hoadley, who has helped us coordinate this tonight and is a cancer survivor, Elise Mason, who is one of our event directors here, and then Patty Piasecki with Rush University Medical Center. I am the CEO of Swim Across America, and I've had the joy of being able to come up and support Swim Across America Chicago the last few years. And then I guess last year you couldn't find your MC guy, so they threw me on the microphone, and me and your MC, your DJ guy were the ones that made all that noise as you guys were going in the water and coming out of the water for Swim Across America Chicago. And I wish we could be there again this year to do that, but unfortunately circumstances have brought us here tonight, where we're pivoting and we're offering a virtual program where people through a coast to coast at Swim Across America Chicago can do any activity they want. And I'll even tell you before I got put on the shelf what I wanted to do, and I'm still going to do when I'm back and able to. My mom, who passed away from cancer and is why I'm involved in Swim Across America Chicago, my mom was famous with us kids growing up for making crepes. And she had this incredible recipe. And so she would make, for my brothers and my friends and I, she'd make 100 crepes on a Saturday afternoon. And within 30 minutes, we would crush them. I mean, you're feeding like crepes to teenagers. I mean, it's 10, 20, doesn't matter. It's like, Mom, can we have more? And as we got later on in years, in our adult years, we've learned what the recipe was. And so I wanted to take, and anybody who was going to donate $25 and that would participate as part of the team that I was a part of, I was going to make six crepes with a couple little sides, and I was going to ship them to you. Or if you happen to be in North Carolina where I'm at, you could come get them. So it's different. That has nothing to do with swimming, but that's the point, is that with the personal challenge, you can do anything you want. And my idea was to do something that tied back to my mom, tied back to something we all like to do and can do, which is eat, and then allow me to just do a little bit of some service for some other people. And so it's different, but that was going to be my personal challenge when I'm able to sort of be able to do so again.
It's so good to see you, Patty. I can't tell you, for anybody involved with Rush, Patty made the biggest difference in dealing with me and my family, and connected everybody and put everybody at ease, and contributed to that knowledge base. So you guys at Swim Across America are lucky to have her.
And that's what we choose to do, is that we make relationships with people. And I think that's part of the charm of Swim Across America, is that you get to some of these charity events and they can be so big, more than 1,000, more than 5,000, more than 10,000 participants in them. And you don't get the opportunity to meet a Dr. Levy or a Patty, or the other oncologists that are there. And sometimes you don't get to hear the survivor stories. But by design, largely driven by the safety side of it, our swims are typically less than a couple hundred people. And that intimacy allows for you to get to know the participants and get to know the supporters and get to hear the stories. And you're also there, and it's only a couple hours that you're giving on a Saturday morning. but everybody coming off of this that can hear and can listen, what you can do to support the Swim Across America Chicago event, which exclusively supports Rush University and the oncology programs there, is you can register at Swim Across America Chicago, and you can take the personal challenge, and you can do any activity. If you want to swim like Mike's going to swim, great. If you want to do something else, that's great as well too. And if you ask your family, your friends to support you, the tools are very intuitive and very easy. It's all a point and click system, and it will link straight up to your social page for you. And it'll drive emails for you. And that's how you can drive messaging, and you can drive support. And then all the proceeds that are raised, we make those available to our grant. And this coming up December, Chicago Rush.
Well, actually, that's a good segue to something Elise and I talked about earlier, which is, it's a small world to have me stumble across your article in the Shield and be able to connect the fraternity and what Pi Kappa Alpha stands for to your mission, and the fact that coincidentally I happen to have found the best people in the world right here at Rush University Medical Center. So, there's a Rush family, there's a Swim Across America family, and there's a Pi Kappa Alpha family, not just in the greater Chicago area, which is probably some 2,500 guys, but throughout the United States. And one of the things that the pandemic has prompted is a group of us in a variety of different disciplines getting together more regularly via Zoom, trying to share knowledge and insights of what's going on around the country. And this is definitely one, once we package up this video, to let guys in the organization, their family members, anybody who's somehow affiliated with Pi Kappa Alpha, both here in Chicago and anywhere, to go onto the Swim Across America Team Pike page and sign up and see if it's something you're interested in taking part of. And none of us have any lack of demands on our time or our resources, but this is a real small world one. There's so many strange little things about it. I know he's not involved with cancer research or swimming, but Daryl O'Connor, who was a Pike from our chapter, is a Rush physician. And when I was actually in the hospital, he stopped by and said hi. So, I know that amongst those 2,500 people, there's going to be more overlap, people who, are looking for something to do to try to enhance the fight against cancer. Because as I said, it touches everybody's lives. None of us are going to get out of this without having either a personal or a family member experience with cancer. Let's hope that we do what we can to deal with it while we're here.
If what you've heard tonight sounds really inspiring to you and you want to become involved like Mike and me and others, just go to swimacrossamerica.org/Chicago. Just add /Chicago on it. You'll find our team page there that you can go ahead and register and sign up for, and pretty intuitive and pretty simple for you to get involved. We use our digital portal of swimacrossamerica.org, where everybody can go to and find any of the 21 communities we're putting on swims. And even if you're, I've had outreaches from people in, say, New Orleans and Salt Lake City who are we may not have a swim in that community, but there's still ways for them to get involved. We have, with this virtual program, anybody can get involved anywhere. We're actually getting calls from people in Europe that want to get involved in South America. So swimacrossamerica.org is the platform to be able to do that.
We would like to thank everybody for joining us and watching this program. We hope you enjoyed it. And most importantly, we hope that you will sign up and join us in this fight against cancer. And with that, I will leave you with one very important message, that our mission does not stop. And one more from Mike Hoadley.
Hope has no finish line.